Thank you, Marisa. I do apologize for being Marisa for breaking the rules, which I don't like in general. And it's not good practice in this house. But I would like just to congratulate everybody of being here. And I'm here to show commitment for us to work together, because this is extremely complicated, difficult issue, difficult for politicians. But if we look at the last communication of Commission on inequalities in all kinds of diseases, but especially in cancer, we will see that there is now a very strong evidence of disparities between member states in terms of cancer. There are some gender inequalities in this regard, and especially not only talking about treatment, but when we talk about screening programs and access to screening of different citizens of member states, we will see how complicated it is, and in some cases it is almost touching the barrier of discrimination. That's why it is very important for all of us to have this support, to have this networking, to be able to help better. And I will give you an example, if our voice is not very strong, how things could go wrong. Here in front of me is my colleague Michel Rivasi, and this will be a reason to allow myself to name and shame. But we started an initiative when we had the problem on H1N1 campaign and on the spendings that have been done by member states in regard to this campaign. So we started this initiative for inquiry committee in the Parliament to investigate how and who and why decisions for enormous spending has been made. And this is actually the example. For France has spent 1.5 billion euro for 3 months to vaccinate the entire population, although it has not been done because people refused, in comparison with the 700 only million euro for 10-year cancer, for 5-year anti-cancer program. You can imagine how unequal is this, and what's the impact of this money if they could have been allocated properly, for example, for cancer research and for supporting better screening programs, only for France. And this is the case for other countries. That's why we call here in this house for accountability, for transparency, and really for evidence-based approach while we talk about decision making. And with the voice of everybody, we will be able to call for this evidence-based approach. We will be able to strengthen the Commission intention to go for more HTA, the so-called health technology assessment, while being able to compare not only the drugs, but to compare also different type of medical treatment. And I think in the future, with all colleagues which are interested to participate, with all patients' organizations and with all research institutes and health professionals, we will make a stronger voice for this accountability and for this evidence-based approach by allocating money. We also try to do some work together with the finance ministers and the Commissioner Dalli on sustainability of healthcare system. And finally, during crisis, although sometimes it may look cynical, we have to take the right decision where the money should go to bring more evidence for people and to bring better results for everybody. That's why I would like once again to here to show a strong commitment and to say that we are very open to continue working together and to do our best to push the Commission, to push the Council, to push national governments for a stronger, even stronger commitment in research, but also in all possible campaigns, and in regard to e-health that could save some money and allocate this money for in a direction that will have a better impact. So thank you very much for inviting me here, and I do apologize for really for the necessity to going out, because I have to join the anti-tobacco seminar, and I think it's also an important issue because it has a lot of relation, especially for children with for passive smoking, in regard to future probably development of cancer. So thank you very much, and I wish success to all of us.
Thank you so much.